Come on in, everybody. Welcome. Welcome to RTBG Radio Newsroom Brief. We're going to give you guys 2 minutes to get in here, grab your coffee, your juice, your tea, your water. Whatever your vice is, grab it. We have a great show for you this morning. We are only going to be on here for 20 minutes, so I have to make sure that I'm watching the time. I don't want to go over 20 minutes because people's attention span nowadays are kind of short. We do have a pinned question in the live broadcast, attached to the live broadcast. And I would like you guys to answer the question truthfully. It's just a simple yes or no. We respect your opinions, and I promise you we're not going to divulge who voted yes, who voted no. We just want to see where citizens of the United States of America stand with the president withdrawing the United States from the World Health Organization. We're going to delve into that in just another minute and a half. Please like and share this video. Before we get started, huge announcement. RTBG Radio's launch date is going to be around February 16th, 15th, or 16th. What does that mean? It means that we're going to be in a bigger studio. It means we're going to have a website. It means we're going to have live guests that you will have an option to hear or see their beautiful faces, that you will be able to chat with our guests and ask questions. So we have some exciting times coming up very soon. We are broadcasting live in the Big Easy, New Orleans, Louisiana, home of the New Orleans Saints, home of the Dragon Masters, or should I say legendary Dragon Masters, the Tumblers. If you ever been to the French Quarter and you've been on Bourbon Street, and they had like this group of handsome, very muscular black men tumbling and doing a lot of acrobatic acts. They are the Dragon Masters. They have appeared on Showtime at the Apollo, America's Got Talent not long after Hurricane Katrina. They traveled the world with the Soul Circus, which is a black version of the typical standard circus. And I'm trying to remember the name of the circus. Something Soul Circus, the Soul Circus. Amazing. If you've never seen the Soul Circus, you've got to see them. It's like a show you've never seen. Well, it's almost that time for the countdown. Here we go. 10, 9, 8, 7, 6, 5, 4, 3, 2. RTBG Radio Newsroom Brief. Today's topic is what U.S. withdrawal from the World Health Organization means for pandemic preparedness, research, and global health intelligence. That is a mouthful. This is maybe a 4-part. What does it mean, the Trump administration's withdrawing the U.S. from the world, means international, the World Health Organization? How's that going to affect pandemic preparedness? How's it going to affect research? How is it going to affect global health intelligence? Pharmaceutical drugs? I mean, the list can go on and on, right? Leave your thoughts in the comments section. Good morning. This is RTBG Radio. And today's briefing is about something that sounds political, but it's not really. It has very real operational consequences. Think about it. The United States' withdrawal from the WHO and what that means for our ability to detect outbreaks early, coordinate research, and stay ahead of the fast-moving health threats? That is huge. The Trump administration says the withdrawal is about failures in COVID-era performance, reform resistance, and lack of transparency, and that the U.S. will pivot to bilateral relationships and alternative partnerships. That's what Trump's administration says. Public health experts and global officials argue it will slow early warning, reduce U.S. influence, and weaken coordination during the next major threat. I'm tapping my news desk because that's scary. That's very scary. So let's lay out what we know and what it means with neutrality. We're going to focus first on the facts of the withdrawal. The administration initiated withdrawal via executive order in January of 2025, according to a U.S. Department of Health and Human Services fact sheet. On January 22nd, 2026, multiple outlets reported that the U.S. completed or formally exited the WHO, ending decades of membership. The WHO published a statement on January 24th of this year saying it regretted the U.S. notification/withdrawal and noted that implications would be considered by the WHO Executive Board meeting starting today, February 2nd, and again by the World Health Assembly in May 2026. This is significant. The administration's stated rationale includes alleged mishandling of COVID-19, lack of accountability and transparency, failure to implement reforms, and concerns about political influence. But didn't President Trump, in his first term, wasn't he allegedly the first human being to receive that life-saving drug? I believe it starts with an R. If you know the name of that drug, please leave it in the chat. And this drug has saved many, many lives since the initial outbreak of COVID-19 till this day. Critics stated concern includes reduced access to global health coordination mechanisms, loss of influence, and slower early warning, slowing the early warning down, particularly for emerging outbreaks and influenza vaccine coordination. The U.S. for decades has coordinated with WHO concerning influenza vaccine coordination and the various strands Now let's talk about what the WHO actually does. I don't know what they do. I bet you don't know either. So what does the WHO actually do that matters to Americans? Not in theory, but in systems. The real value, folks, why the WHO membership mattered in practice, is because the World Health Organization, known as WHO, is not just a global health talking shop. It's an operating platform that connects national health agencies and labs and reporting channels across the world. If you strip it down to essentials, WHO membership gave the U.S. 4 major advantages. First, early warning and outbreak intelligence, signals and alerts from many countries at once. 2, standards and coordination, common rules for reporting, sharing, and responding. 3, scientific networks, labs, data pipelines, and technical groups that speed research decisions. And lastly, but not least, influence. A seat at the table, shaping global priorities that inevitably affect the U.S. So the key point is this: pandemics don't respect borders. Early signals often appear abroad first, then later arrive here. So the U.S. doesn't just benefit from quote unquote our own information. That's very naive to think so. We benefit from thousands of eyes and laboratories worldwide feeding into shared systems. We benefit from thousands of eyes and laboratories worldwide. Once again, I repeat, feeding into shared systems. Similar to how law enforcement in our country feed into shared databases, especially DNA databases. That's the baseline. Early warning systems, international health regulations, is one of the most important mechanisms in the international health regulations. It's called the IHR. It stands for International Health Regulations. The IHR is the international legal framework that governs how countries identify, access, report, and respond to public health events that could spread internationally, and it defines the role of WHO, World Health Organization, and member countries, including the United States. In practical terms, the IHR creates reporting expectations, national focal points for communication, an escalation pathway for potential international emergencies. The U.S. Centers for Disease Control and Prevention describes the IHR as requiring countries to detect, access, report, and respond, and to report certain diseases or events through a network of national focal points. This is huge. So you may ask yourself, why does this matter? You may be thinking, Why does this matter? I'll tell you. Because that network functionally reduces blind time. That's why it matters. Blind time is the period between something emerging somewhere in the world and your country understanding it early enough to act. With outbreaks, the cost of blind time is delayed travel guidance, delayed screening, delayed clinical awareness, delayed lab readiness, and delayed manufacturing decisions for vaccines and therapeutics. Wow. WHO, the World Health Organization, doesn't replace U.S. capacity. It multiplies it by connecting it. If the U.S. is outside the formal membership structure, the U.S. can still learn information through other channels, but losing formal participation can reduce coordination and influence over how that information is structured and shared. Let's look at the flu, for example. The flu, influenza, is a perfect example. GISRS and vaccine strand selection pertains to influenza because it's clear, tangible. It's a great tangible example of global health intelligence benefiting Americans every single year. The WHO, World Health Organization, runs the global influenza surveillance and response team. This is what GISRS stands for. Global Influenza Surveillance and Response System. A network built over decades for influenza surveillance, preparedness, and response. GISRS helps track which flu strands are circulating, where they're circulating, what mutations may affect severity or vaccine effectiveness. And folks, this matters because the seasonal flu vaccine is updated based on what strands are expected to dominate. And WHO, the World Health Organization, recommendations are issued twice a year. Northern Hemisphere and Southern Hemisphere, based on global data, a U.S. National Academies reference described how WHO collaborating centers provide data that feeds WHO vaccine strand recommendations. Now, here's the U.S. specific benefit. The CDC's Influenza Division serves as a WHO collaborating center in Atlanta with a central goal of monitoring influenza virus changes to reduce impact through vaccination. And CDC describes its global influenza program as improving global capacity, building surveillance, and helping improve availability of effective vaccines in the U.S. and globally. So the U.S. benefited from WHO, the World Health Organization systems, in at least three major ways here. First one is early detection of strain shifts worldwide. 2, shared viral samples and sequencing information through global networks. And 3, coordinated decision-making that improves vaccine match. If formal participation becomes uncertain or diminished, the risk isn't we will have no flu data. The risk is that participation becomes less seamless and timing, access, and coordination become harder. And that's not abstract, folks. It affects vaccine planning, production timelines, and confidence in vaccine match, which impacts hospital burden every winter. Preparedness metrics, joint external evaluations. Well, another quiet but crucial WHO, World Health Organization, link system. And the number one is preparedness evaluation. Very important. The joint external evaluation, known as the JEE, is part of the IHR monitoring and evaluation framework. It's a structured process for assessing a country's health security preparedness. The U.S. participated in JEEs, and WHO, World Health Organization, has published materials noting U.S. engagement in evaluation processes. Independent health policy analysis has also described U.S. participation in JEEs and support for other countries' planning following JEEs. Why would Americans care? Why do Americans care? Because global preparedness isn't charity. It's firewall building. Just like having an internet without having a strong firewall, viruses can get in and destroy your entire system. Completely eviscerate your entire system, just like global lack of preparedness by the United States. When other countries detect faster and respond faster, threats are less likely to spread internationally, including into the U.S. And I must remind you that there are many, many, many Americans who live and work abroad. And many are also expats. If U.S. withdrawal reduces our leadership role in strengthening these systems, it can indirectly increase global vulnerability. And global vulnerability eventually becomes domestic risk. Now, I'm about to tell you what the U.S. loses. Not all info, but speed, access, and influence. Now, let's go ahead and let's talk about our pinned up question. Now, we're going to save the pinned up question for last. Let's talk about the main question that I raised. How did the U.S. benefit from WHO, the World Health Organization information, and how hindered will we be without it? I'm about to give you the most accurate, neutral answer. The U.S. will still have powerful domestic agencies like CDC, NIH, FDA, and can still do world-class research and response. But withdrawal can hinder the U.S. in specific ways, such as real-time coordination and first notice access. These two are the most important: real-time coordination and first notice access, which is the value of WHO, the World Health Organization. That's a hub for many countries at once, not just one bilateral partner. Bilateral agreements can help, but they're fragmented. And you don't know which country will have the first key signed the first key signal next time. Systems level influence. When you're inside WHO, the World Health Organization structures, you help set priorities, standards, and practices that affect international response. Outside, you get less say, even though what happens globally still affects you. Technical networks and embedded expertise. Well, reports indicate U.S. personnel and relationships connected to WHO work streams were recalled or reduced during the withdrawal process. Even if scientists collaborate informally, formal access and roles can change. Scary. A risk of delay during the fast-moving events. In the early days of an outbreak, speed mattered. Speed mattered. And speed should matter today. Any reduction in seamless information exchange creates the risk of delay, even if the delay is small. And in a pandemic, small delay can be huge. How would that be helping the American people, the taxpayers? The administration's argument, what they say they're doing instead, and I'm going to give you as much of a neutral briefing that I possibly can, but yet fairly state what the administration says it will do. The HHS fact sheet and related U.S. statements indicate the withdrawal decision is tied to COVID-era criticisms and a plan to pivot toward alternative partnerships and bilateral engagements. What are those alternative partnerships and bilateral engagements? That information, to my knowledge, has not been released by Trump administration. So we'd like to see what are those alternative partnerships and bilateral engagements that they are proposing. That is a public request information that we, the public, have the right to demand and see. The core theory is, instead of WHO, the World Health Organization, the U.S. will coordinate through direct agreements and other organizations while maintaining internal agencies' leadership. What other organizations? Again, who are these coordinated other organizations? And what are these direct agreements? What do the direct agreements say? That approach could preserve certain forms of cooperation, but critics argue it does not replace the unique benefit of a global hub and may reduce U.S. access and influence. Do you agree? Leave your comment in the chat. So, for listeners, this is a strategy choice. And the risk is not no health system. The risk is losing global integration in a world where integration is what makes early response possible. So here's the bottom line. The greatest public health value of WHO, the World Health Organization membership, is not in press conferences. It's in the quiet infrastructure, the networks, alerts, lab coordination, surveillance systems, and global standards that reduce blind time. The U.S. benefited from global surveillance pipelines, especially influenza, IHR reporting and escalation frameworks, scientific networks that support faster decisions, preparedness strengthening across countries that reduce spread risk. So what are your thoughts? What do you think about the pullout? What do you think about U.S. withdrawal from the World Health Organization? Do you think that was the right decision? Yes or no? Please leave your comment in the chat, and you can also submit your answer in our poll question. I want to announce that RTBG Radio Newsroom Brief will be live every day, 7 days a week at 11:30 a.m. Central Standard Time. If you would like to advertise on RTBG Radio, please inbox us, and our staff member will be in contact with you. Again, RTBG Radio will announce very soon the official launch date of our radio station. The actual radio station, the website, and our beautiful, beautiful newsroom. Once again, thank you for listening. Please like and share this broadcast. Stay warm, stay safe, and make sure you come back tomorrow for more exciting news. RTBG Radio is out. Enjoy the rest of your day.